Okay, so it's the day after surgery. When I woke up from surgery, I was in quite a lot of pain. On a scale of 1 to 10, I was probably about a 15. It took 2 shots of morphine and some other drug to get me down to a 2 or a 3 in pain. Later on, the pain wasn't quite so bad. What they did end up finding was that ligament that I was talking about. It's called the ligamentum something femoris. I don't know. It's the ligament that's from the hip to the femur. It was partially torn or frayed, and I believe he ended up cleaning that up a little bit, but I'm not sure. I'm getting conflicting answers. And he did go ahead and tighten up the hip joint. So I guess I'm just on my way to recovery, hoping that that actually fixed the problem with all the pain that I was having. I forgot to mention in the last video that some other pain that I was having was whenever I would stand up from sitting, I would have a sharp groin pain sometimes. And also if I was laying down in bed and I wanted to lift up and move over a little bit from lying on my back position, I would feel like it was tearing something inside my leg. Other than that, I'm on crutches. The crutches are a pain in the butt. I've got a big brace on. I don't know if you can see. This brace thing has got this handy dandy tube that hooks up to this ice thing. I don't know if you can get a clear picture. That plugs into the wall and you keep ice in it. You need plenty of ice around because it took up all the ice in my freezer and I don't have any more ice. So we are having to buy bags of ice to put into it. You hook those two things up, one to the wall and then the brace to that, and it cools your entire leg, which is really good. For me, after the surgery, when they first hooked me up to the ice, it hurt really, really bad. I guess it's not a normal reaction because they were kind of surprised that it hurt for me. Other than that, they got me on painkillers, 7.5 milligrams of hydrocodone. I can take 2 of those every 4 hours if I like. Sorry, my arm's getting tired. But other than that, the pain is worse, I guess, when in the morning, because I wasn't on painkillers all morning. I didn't feel like getting up and eating something to get those because I get nauseated with the painkillers. I see the doctor in 2 weeks, so I should have more information on what was actually done in the procedure, but I talked to the doctor today and he said that he was afraid to trim the ligament too much because normally it's a really kind of thick ligament, and mine was actually really thin, so he was afraid to do any more to it because he was afraid it would cause more pain. So I'm guessing the reason he tightened up around the joint and everything was to possibly prevent that from tearing anymore. But I guess that's all for now, so I'll probably be making another video later, and probably in a couple weeks to let you guys know how everything's going. So alright, well, thanks for watching, and hope this ends up helping somebody who's considering going through surgery when nothing shows up on the MRI. Thank you, and see you later.